Okay, this is just introductory presentation, brethren. I just want to greet you in the name of our Lord Jesus Christ. We spoke amongst ourselves, the three presenters, and we found that we cannot do justice in 10 minutes. We cannot do justice in 5 minutes. So what I'm going to do is to just touch here and there some of the issues. We really would like to align ourselves with WHO presentations. There's a lot that you get, the professional presentation on vaccine, on prevention, on disease processes, the pathophysiology, the anatomy and physiology that is, and the tissues, body tissues that are affected. There's a lot that is, I'm going to take off. There's a lot that is there. But we want to align ourselves with WHO. We want to align ourselves with the national health policies and national health documents. So first, I want to talk about the overview of the virus. Coronavirus disease is an infectious disease caused by a virus that is discovered. With that, okay, I managed to shift it. Coronavirus disease is an infectious disease caused by a newly discovered coronavirus. We say it's newly discovered because it's hardly a year after it was discovered, first discovered around November 2019. That's why its name is called COVID-19. 19 there represents the year it was first discovered. It is known as severe acute respiratory syndrome, coronavirus 2. That is the abbreviation of the name there. As this acute virus 2 belongs to the Sabecovirus or Sabecovirus subgenus of the Coronaviridae family. That is the family of the in virology. That is what they do to categorize these microorganisms that causes disease into groups so that they can be able to target them in terms of research and management. So it belongs to the Coronaviridae family and is the 7th coronavirus known to infect humans. There are several of them. Some of them are only found in animals, and this is the 7th known to infect humans. The disease is caused, the disease, no, there's a typo there. It's called coronavirus disease. The pathophysiology, most people infected with coronavirus will experience mild to moderate respiratory illness and recover without requiring special treatment. You, brethren, will recall when I notified people that I have the symptoms that I think are related to corona. I couldn't taste, I couldn't sense. Then I took it, I have a mild infection and I isolated myself. So some people, it will end up there, it will not progress further. And for some people, it progresses further. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days for symptoms to show. So you cannot say, I have been in contact for 5 to 6 days. If I don't have symptoms, then it means that I was not affected. There are people who were exposed. When they go to test without symptoms, they found that they are positive. Hence, it is very dangerous to say this person is safe because he does not have fever, he does not have coughs, therefore I can be safe with them. That person could be a contact. that is having the virus spreading, but with no symptoms yet. The mild symptoms are fever, dry cough, and tiredness. Less common symptoms are aches and pains, sore throats, diarrhea, conjunctivitis, headache. Conjunctivitis is inflammation of the eye lining. Headache, loss of taste and or smell, a rash on skin, or discoloration of fingers and toes. These are less common symptoms, but they're still symptoms anyway. Serious symptoms: difficulty in breathing, shortness of breathing, severe chest pains or chest pains, or pressure and loss of speech or movement. Hypoxia of the brain may cause a level of delirium, and delirium is restlessness and confusion. So if you look at this picture, I thought a picture will tell us a lot of stories. You will notice that this person is coughing, spreading the infection. Perhaps you inhale the infection. It goes and lodge itself around the throat here. When they take a nasal swab or the throat swab through the mouth, then you can be found to be positive, but the virus can descend through the respiratory tract into the lungs, or through the GIT tract into the stomach there, and then it can cause damage, or it can affect the epithelial cells of the stomach, which would cause diarrhea. It can also go, where is my cursor now? Okay. It can also go to the lungs, where it will affect what we call an alveol. The smallest cell of the lungs is called the alveoli. This picture shows the alveoli here and how the virus will go in, and all the scientific things that will happen, the interleukin-6 release, the nephrotic cells, and the disease cells. These are just the body reaction to inflammation. Should the lungs and the tissues of the lungs found to be wanting or have no resistance, the disease will progress into generalized inflammation in the alveoli or into the epithelial cells of the alveoli, causing low perfusion of oxygen, which is when you go to the pulse oximeter, you have a low intake of oxygen, because this cell is the one that caused that, where gaseous exchange happen. If this cell is affected, the alveoli, then the whole body will be lacking oxygen. And once the body lacks oxygen, we have hypoxemia, which is just another word of saying that there is a lack of oxygen in the blood, which can lead to sepsis. That is another a pathway which can lead into multi-organ infections, and thereafter, if it's multi-organ infections, and it's death. Another pathway could be, it gets into the lungs, it gets into the pulmonary arteries, it gets to the heart, then it goes to the circulatory system, then it impacts on the blood pressure, it impacts on perfusion of blood. Then there is acute respiratory distress syndrome, which leads to multi-organ failure, which leads to death. This side of the slide, I'm not going to talk about a lot. It's about treatment. Different research organizations are researched on various treatment types. You will remember that at some point they were saying chloroquine can help. So efficacy studies were done. It was found to be not effective that much. And there are so many drugs that are being researched, and we have yet to hear about the efficacy. And you will notice that these drugs are supposed to be targeting different areas of the alveolar. This arrow shows to the alveolar. So the details this side, I will leave to the medical professionals. These are just other drugs. Corticosteroids, we heard that dexamethasone was at times said that it improves the condition. Yes, because it for a short while the corticosteroids will have impact on the anti-inflammatory state. I will pass. We can come back when brethren have questions on these slides, but this is how the disease progress. Now, having spoken about the progression of the disease and having seen the picture, which is speaking a lot, we have to talk about treatment and management of this condition. In public health, we talk about the first line of defense is health promotion. It's the behavior, it's what you do as a healthy person before you actually get sick. Individual behavior are important, such as social distancing, hand washing, hand sanitization, covering your mouth with your elbow when you cough, and all those things that are being publicized as notions to change our behavior. So the sooner the individual begin to realize that I have got to do something to protect myself from being infected, or to protect them, my contacts, the people who are around me, the people I love. Hand washing is very important. It's absolutely important. There is a study that is going on at TUT currently about hand washing behavior amongst health professionals. The results, I am not in a position to talk about the results currently, but the results are quite interesting as we collect the data. I will come and share it with you at a later stage. We have to eat right. We have to take food that have vitamin C, vitamin B12, zinc, selenium, vitamin D. Selenium will be found in things like and green leafy vegetables. Vitamin B12 proteins, meat, all kinds of meat, vitamin C, all the raw vegetables and raw fruits have some levels of vitamin C. Moringa, whenever they have high levels of vitamin C. Kabishi, when it's raw. The problem with us people is that we want to cook it until it's brown. Once it becomes brown and well fried, it is of no value to you. If it is just raw, or if it's just cooked for 5 minutes and you remove from the stove, then it is good for your for consumption, and it's good for your body. Spices that you can take is ginger, garlic, turmeric, cayenne peppers. They are very good to use in your cooking, and yet they are good in building the immune system. Drink plenty of water. This helps to loosen the mucus, and you will, because we have dry cough, when the mucus is loosened, when you cough out the mucus, then you clear the airway. It has the same effect with steaming. You don't have to be steaming with medication. You can also steam with just hot water and maybe salt, a little bit of salt, or hot water only. It will still loosen the thick mucus if you have thick mucus. Use sugar and salt and oil sparingly. I can't stress this enough. Then we have preventative level, which is vaccination. There's a whole lot of conversations nationally, internationally, and amongst us in the media currently about vaccinations and vaccine development and vaccine distribution. I I shied away from going into details with vaccination. But what I can tell you that is that normally it takes 3 years from development to distribution of vaccination and to education of the community about a vaccine and to finally implementation of giving it. So this one was fast tracked because of the devastating effect, and we need to look at uh, the benefits vis-a-vis the potential dangers. That one, I don't think I qualify to talk about it now. I think you need to read and to follow the advice and to listen to your spirit. A lot of people are saying that the viruses affect the DNA and the RNA, then it changes your chromosomes. I have reason. There is an article that I found. I just didn't read it all, so I couldn't refer to it. That says yes, it is an RNA converter virus, but it does not enter into the polymerase into the right place to be able to change your genome, to be able to change your chromosome. So that one I'm not going to talk about today, but it is relatively safe as the articles that I saw today show. There is a long debate about and confusion about uh, vaccine and readiness, as I say. But I want to say we have to acknowledge that people will have questions, and those questions should be answered. And there is no right or wrong question, there is no stupid question. If the question exposes that the person does not know in terms of public health, you've got to continue to educate and educate until people understand. For I remember at some point when I was in primary school and there was a group of nurses that came to give us injections of smallpox. And the mothers in my village all came out to come and stop these nurses from injecting their children with this deadly vaccine. And now smallpox is a history. And guess what happened? My mother was a teacher in that school. My father was a teacher in that school. And the people in the village where I grew up were saying, start with your own children. Take Tendani out. Come and give this injection to Tendani. And I became the victim. I was injected with this smallpox injection. So people have to be educated. And eventually people were vaccinated and they realized that this girl is resilient, is not dying of this vaccine, and they allowed their children to be vaccinated. And now we are talking, this disease is history, it's totally not in the system. Um, uh, Vaccine education should be done for even for health professionals. There's an article that says health professionals were asked if they will vaccinate themselves, and they were saying, some were saying we will not vaccinate, and some will say we're saying we will vaccinate. So it all boils down to one thing: education of both health professionals and the public. The information is found in WHO website. This is just a picture of nutrition. All these vegetables are better eaten raw. Okra, the seeds, and all the green leafy vegetables. If you eat them raw, they are the best. But if you cook them, don't cook them for an hour. Water is the best. I didn't put juice for a reason. And that's just nutritional. Bear in mind that raw tomatoes have vitamin C. By the time you cook it in gwengwerere, the vitamin C is gone. So tomatoes are better off eaten raw. Other measures to keep spreading would be family protection. Those of us who work in the health sector, who work with transport, taxi drivers, who work outside the family, will need to protect their families at all costs. When you get home, you wash your hands before you even touch your children. You take off the clothes that you wore to work on that particular day. They go to a separate washing machine. If possible, wash them when you take them off so they don't mix with other family washings, because the virus can be found in clothes that you have worn and in surfaces. So, and then if you think you have been being a contact, isolate yourself. If you think that you have symptoms, quarantine, go to quarantine, get yourself tested so that you can do the right thing. So it is very important that family is protected, even by nutrition. When you have buy vitamins, vitamin C's and stuff, buy for everyone in the family, even children. The new variant is also affecting children, so we can no longer say our children are not affected by by coronavirus. Community measures. This is very important. I wish I could take time with all of them. Avoid family gathering that are unnecessary. Funerals and sporting event, follow government guidelines. Church gatherings, practice social distance. Okay. With church gatherings, practice social distancing and follow regulations and national health. Avoid hugging, talking into each other's face, whispering to each other, because that uh, is risky in terms of risk assessment. The work environment screening, organizational policies should be followed in line with the government. Shopping environment, when you go shopping, understand that in queues, in by just coughing in an open space when there are around people around, you could receive the virus, or you could share the virus. So let us be um, conscientious of what we do, cleaning the surfaces of the trolley. When you come back with food, decant the food into containers that are at home, that you can sanitize the outsides thereof. Don't keep the food in boxes, because you take microorganism from the shop. Let's say, for instance, while you went to buy a box of wheat picks, it has been handled by other people that you don't know. You picked it up, put it in your trolley. It was handled by a cashier. You come back with it, you keep it in your in your cupboard. It's better if you find containers to decant such things, so that from the time when you decant, you sanitize your hands, you sanitize the container, and the container is clean, and there is no threat attached to the food that you just bought. While using public transport, studies shows that drivers are susceptible to diseases that can expose commuters to. This is those are the authors of those that article. Um, So when you are using taxis, be careful, have your own sanitizer in your bag or in your pocket, so that if the taxi driver does not have sanitizers, you sanitize. While you are sitting in the taxi, uh, maybe it's a long distance taxi or transport, uh, have your mask on all the time, and every now and then, 30 to 45 minutes, sanitize your hands with your own sanitizers. The other public interventions, reduce alcohol availability. The government tried this with a lot of challenges, but alcohol reduction has proven to be a public intervention that could work. Reduce cigarette smoking in public, and there was an outcry. Cigarettes in themselves, with themselves, they affect the lungs. They cause an inflammatory response of the lungs without the exposure of the COVID infection, and therefore the lesser we take of cigarette smoking, even passive smoking, is very important. Hence, at work, if you are sitting next to a smoker, and they smoke, and in the office or just at the entrance of the office, that exposes you to passive smoking, please request that person to go to the designated area for smoking so you don't become a passive smoker. Government tried lockdowns at different levels. We are currently at level 3. We went through level 4, level 5, and we felt isolated. It has its own impact in our mental health. I think Dr. Kodisang will speak about it. Economic interventions, we saw people getting grants because they cannot work. We saw them people applying for relief funds, and government has been trying to meet this need, but it is having its own impact. It might even have its own disadvantages in the long run. We watch and see as reports by research by economists are going on. We have cultural interventions in all its varieties. Research shows that 60% of the population, whether white, black, first seek traditional and home remedy treatments before they go to the hospital and before they seek medical health. So us as medical health, by the time the person comes to the clinic, we know that they have tried something. So we should look at those things that people say they have tried and they are working. And sometimes it is good to even advise people. For instance, I'm a primary healthcare professional. If a person comes to the clinic with an ordinary flu, I would say go try mixing lemon with honey and ginger and drink, because it reduces coughing. It has good effect. So that is remedy. That is a remedy. Uh, Things like bochumbe umbe, mhlonyane lingana, all bitter herbs and smelly herbs in their variety. I don't think I have the authority to discourage them, but take them with precautions. Bearing in mind that the Bible says, God says we must go and eat bitter herbs as part of the nutrition in Genesis. So if the herb is bitter, it means that it's good for your body. That is what the Bible says. Eat bitter herbs. So do not steam or drink all these things for the whole day. Like you boiled them in the morning, you use them as water. You drink shumbe umbe, you drink mhlonyane the whole day. We do have studies that are going on with regard to kidney failures and liver damages caused by overdosing on these things. Medical treatment. All medications used in South Africa must be approved by the South African Health Products Regulatory Authority. That is mandatory. All doctors practicing privately or in public health must be registered with the with Health Professions Council. So make sure that you are consulting qualified doctors. Qualified doctors, when you get into at the entrance of any qualified doctor, they would either have a certificate of their qualification, their practice number, and where they are registered. That is authentic. If you want to query that doctor, you can take a picture, go to the health professions, and go and ask them. And in South Africa, nurses who are qualified will be wearing some form of distinguishing devices. Professional nurses will be wearing red epaulets. Staff nurses will be wearing white epaulets. Assistant nurses will be wearing a badge that shows that they are enrolled with the South African Nursing Council. So if anybody comes to you and say, I am a nurse, and they are not having those distinguishing devices, then you can query them, unless they say they are community community workers, and they are working with because now they are working with the professional nurses under WAPOT. If in doubt, get second opinion. It's very important that you know that as a person who is consulting a health worker at any given time, no matter how this doctor is supposed to be a specialist, you have the right to seek for second opinion. And the doctor has to follow the principle of Batubili while treating you. So you have the right for redress according to Batubili principles of South Africa. All patients have patients' rights. So I would advise you to read the lymph pump medication information leaflets of the medications that you are given. If you don't have information leaflets, or you are getting decanted medication that has been decanted or distributed without a leaflet, you have the right to request for a leaflet giving you information on the medication that you are getting. Take note while you are reading the information leaflet that the information leaflet should reflect the signs of toxicity and the side effects. How do you take a drug home that you don't know the side effects thereof? So and come and use it. When you begin to have side effects, you don't know. So please ask for the toxicity information on the toxicity for that drugs and side effects. The general understanding is that antibiotics cannot be used to treat viruses. The antibiotics treat bacterial infection. Antifungals treat fungal infection. Antiparasites treat parasitical infections. Viruses are lulled. I repeat, they are usually, the effect is lull. They don't kill the virus. Antivirals that we are getting for HIV/AIDS, they don't kill the virus. They stop the virus from reproducing. So we must be well conversant with that. Most upper respiratory treatments are asymptomatic. Treatments are symptomatic treatment. They treat the symptoms. If they give you say a decongestant, I don't want to advertise a decongestant because you feel congested and you are coughing. The decongestant is going to solve the problem of congestion in your lungs or the nose. If you have headache, they will give you something that will treat headache, Panado. And they will give you a medication that will make you sleep so that you can gain the energy. The body can recuperate and gain the energy to can fight the virus. Hence, once you are infected, you must rest. You must rest. Before I say, and I will say, you also need, if you are sick with this condition, you also need to exercise. So I couldn't add the benefits of exercising here because I thought the presentation would be too long. There you go.